Hi, good evening everyone, and welcome back to my channel. Today I would like to discuss a sexual transmitted disease, which is genital herpes. Now, this is a very common sexually transmitted infection, and I just would like to have a talk as a professional about the disease, how it is transmitted, how to prevent it, how to treat it, and just some general information about this condition. So, genital herpes is a very common sexual transmitted infection, and 1 in 6 people ages 14 to 49 years have genital herpes. 40% of people with genital herpes are non-Hispanic blacks, and this was taken from statistics in the United States in 2018. So you can see where our people are being affected by this infection. I don't know if it's because of our lifestyle, if it's because of lack of education or lack of information, but I'm here to share information with you about this disease today. It's not a disease, it's an infection, so let's call it a sexually transmitted infection. So genital herpes is caused by the herpes virus type 1 and type 2. Oral herpes, which is type 1, can be spread from the mouth to the genitals through oral sex. So if someone has a sore on the lips or on the mouth and they perform oral sex, they can transmit the virus from the mouth to the genital area. So let us discuss how genital herpes is spread. It can be spread via the vagina, it can be spread to the anus, through oral sex with a partner who has the herpes virus. You can get herpes from a partner even without visible herpes sores or blisters. This virus can live in your bloodstream. It is not cured, so it will stay in your bloodstream and it can still be transmitted even though the person doesn't present with any signs and symptoms. How do you know if you have genital herpes? People may have very mild symptoms. Most patients have no symptoms. Mild symptoms may look like a pimple or an ingrown ear. A typical appearance can be 1 or more blisters on or around the genitals, the rectum, or the mouth. The blisters can take 1 to 2 weeks or longer to heal, depending on your immune response. Other symptoms include fever, body aches, swollen glands. Patients can have repeated outbreaks, and the infection can stay in the body for the rest of your life. So as I said before, it is not curable. You can treat it, you can suppress it, but you cannot cure herpes virus. A lot of people have commented on my past videos about getting cured from herpes. Herpes virus is not cured. It is treated, it is suppressed. So if you think that you have the herpes virus, speak to your doctor about the options to treat or to suppress, but do not get the impression that, oh, this is cured, and because I don't have any symptoms, then I don't have the virus. So again, can genital herpes be cured? No, there is no cure for genital herpes. So remember to have this discussion with your doctor. There are anti-herpes medication that can prevent or shorten the outbreaks, and anti-herpes virus medications may be taken daily to suppress the infection. Daily use can reduce the transmission to your partners. How to reduce the risk of getting genital herpes? Okay, so this is a tricky one because most people a large percentage of people are not sticking to one faithful sexual partner. So if you're having more than one sexual partner, then it increases your chance of getting genital herpes. Using a latex condom the right way every time you have sex can reduce the risk, but condoms are not 100% protective against genital herpes because the blisters are not always covered with a condom, so you can still be exposed to the blisters and contract the virus. If you or your partner have genital herpes, you need to speak to your doctor and take your anti-herpes medication daily to suppress the virus and reduce transmission. Avoid sex during active outbreaks. So if you have blisters that are there that cannot be covered, make sure that you're avoiding sex at this time because it can be transmitted when the blisters are out and active and cannot be covered. Pregnancy and herpes. So if a woman is pregnant, she can transmit the virus to the unborn child during delivery. If you're pregnant and you have genital herpes, your doctor may prescribe antiviral medications, and these are usually given towards the end of the pregnancy so that the baby is not exposed to any blisters or sores on the vaginal area. If you have genital herpes symptoms like blisters on the vagina, the doctor may perform C-section so that the baby doesn't get in contact with these viruses. So there you go, guys. I've just gave you a brief summary of the sexual transmitted infection, genital herpes. Thank you for watching my video. If you want to see more informative educational videos, I tend to cover health topics. I'm a pharmacist. So continue to watch, like, comment, and subscribe to my videos. Thank you for watching. Bye.